Hey everybody, what's going on? So today I am going to Spa and Shoreline ER. I'm going to be working as a preceptor there from 7 to 3, so from 7 a.m. to 3 p.m. I'm very excited. I think it's going to be a lot of fun. So some exciting things going on. The first one, I finished my drawing video and I submitted it, or I posted it on YouTube. I didn't submit it, right? And I think it went really well. I just got a fresh cut, by the way. You can't see it because I'm wearing a hat, because I don't want to spend 2 minutes fixing my hair. Probably should have just done that instead of wearing a hat, but it's too late now. Anyway, I'm very happy with it. It took me a bit longer than I expected, and it kind of threw off my scheduling pretty badly. So I really need to pick up the pace. It's all my fault, but need to pick that up very soon. I also kind of had a revelation while I was working on a video. I was at work at Annabelle, working on a video while talking to a student, going over different things that they need to memorize, because we have write outs constantly. And I was talking to him about the mnemonics for APGAR and GCS scoring. Then I realized, you know what? The APGAR score is not really that hard to learn. If you think about it, it goes from a scale of 0 to 2, 0 being absent or non-existing, to 2 being in a good state for pediatric or newborn vital signs. You wouldn't even say pediatric, you'd go more into newborn or neonate. And so I went over that with them, and then it just dawned onto me. I was like, you know what? This isn't even that hard to learn. As long as you know what the extremes are, that's all that matters. If you have a kid with a pink body, okay, pink is good. That's a 2. If you have a kid with pink body but blue arms, okay, but something, okay, that's a 1. You have a child who is pale or blue, that's a 0. Same with their heart rate, right? So if we think about their pulse, so that was appearance, next is pulse. If we have a pediatric a newborn, a neonate, and their pulse is 140, 160 beats per minute, fantastic. We like to see it. What do we know from the PALS guidelines? I think that's pediatric advanced life support algorithm. I think so. Well, we know that if a child has less than 100, or between 60 and 100 beats per minute for their heart rate, well, then we know that we need to do oxygen administration, right? So we need to use the BVM. We need to breathe for this child. If a newborn or a neonate has less than 60 beats per minute for their heart, okay, well, now we need to move more into, we give 30 seconds of oxygen. If that doesn't work, we need to move into CPR. So, excuse me. Just food for thought. I thought it was really interesting. I didn't get to work with this class at all, which was not very fun. I like to instruct and be one of the lecturers for a course, but sometimes, my schedule is just too busy to the point where they can only assign me a day as a skills instructor. It kind of stinks, but it is what it is. Next upcoming class from March 15th, or today's March 15th, so March 16th through the 30th, I am going to be involved in that lecture. Excuse me. So I'm very excited. So that's going to be really cool. I'm very excited for that. I still think it'll be fun, teaching these guys, but it kind of stinks that I don't have a past rapport with them. But it is what it is. Luckily, it's only from 7 to 3. I looked at the schedule, and for a second I was like, oh man, am I going to be there from 7 to 3 and then 3 to 11? But it doesn't say that, so it should be good. I do have some food waiting for me at home, so I'm excited for that too. Some other big things. I have been pre-selected to joining into a RN program, which is really weird, because if you think about it, it's they sent me a letter saying, congratulations, you've been accepted. I want to be happy about it. I want to tell some of my family about it. But then it's also like, well, hold on. It says you've been selected, but then we need you to submit something for your application to be selected. It's like, congratulations, you're accepted into our program. Please respond to this email within like X amount of days, and submit this and this and this as we work on your application thing. And I was like, well, what the heck is that? So am I in? Am I out? Am I in? I would like to be in, please. But I'm very excited for it. Oh man, I'm gonna learn so much. I'm gonna learn so many new things, new concepts that I haven't like muled over with in like years, and even begin to think about, you know. If you ever want to trip up somebody who's an EMS, who's like a know-it-all, they think they know everything, just tell somebody they have like, let's say like joint pain or something, like let's say in like their right extremity or their right toe or something, let's say their second digit, so like their index finger or their, I don't know if you say index toe, and then say, yep, they have a sharp pain, it's red, it's tough to move, they've had pain for about the past 2-3 months, and just build it up into being a gout diagnosis. And so gout is like whenever uric acid builds up and it almost turns into like crystals within the joints, and it causes this redness. I've seen somebody one time whenever I used to work at a clinic where they had literal pouches on their arm, and just on both of their arms, just because of the excessive amount of uric acid that they had built up. It was just like little pouches of crystals in their arms that were just stabbing them constantly. So they were in an extreme amount of pain. It's usually affected with diet. So we think of like organ meat, right? Like liver, I think kidneys. I know liver is a big one. I don't know if the brain is considered one of them. But really interesting. I don't know exactly what chemical component really causes the uric acid buildup. But again, I'll learn it in nursing school. But if you want to trip up somebody who's an EMS, give them a patient with that, and they'll go through everything. They'll go through all their algorithms, and then you'll be like, it's gout. It's like, I guess you really only know this and this, right? So I've tripped up quite a few people on that. Whenever they suggest like, oh, we know everything a nurse knows, and I'm like, well, this is a basic thing that's not too hard to catch for a nurse, but it's really difficult for our profession to catch because we focus on different things. So it's a fun food for thought. I am really excited though. I have an okay understanding of some basic lab work, but I don't know all the ins and outs of it. So I can't wait to study up more on that, learn more about labs, learn more about maintenance medications. Now, excuse me, I've kind of built up a bias over the years where, as like an EMS professional, I feel like sometimes they expand too much on everything that maintenance medications do. Like, what's a beta blocker, right? So you think of like metoprolol, and then you think of metoprolol succinate or metoprolol tartrate. They're very important that you know the difference, because I believe tartrate is BID or 2 times a day, succinate is 1 time a day. Matters a lot whenever you're trying to deal with somebody's maintenance medications. Maybe we look at losartan or lisinopril. These are all blood pressure medications, by the way. Or enalapril or amlodipine. I think amlodipine is a blood pressure medication. I believe so. Anyway, so sometimes they learn like, oh, what's a beta blocker? What's the other one? There's a couple of different other ones, but they'll learn all the ins and outs and intricacies of them, when all they really need to know is, if they look at this medication, is this a blood pressure medication? Is this for hypertension? Yes? Okay, move on, right? Do we need to know what variation of blood thinner this is? No. What we do need to know is, if we look at this, oh, it's Eliquis, okay, it's a blood thinner, move on, right? And now, going more into nursing, well, now I really need to know what the all ins and outs are, and I've already built up such a bias of like, it doesn't really matter, just know this is for blood pressure, no, this is for blood thinners, know that this is for cholesterol. So we think of like a statin, like simvastatin, atorvastatin, things like that. Man, I need to work on my maintenance medications again. But you see the statin at the end, so you can think of that. I just need to reshape my mind, make sure that I have a open mindset when it comes to these kind of things, and I think I'll do decent. I'll try to succeed. I want to be one of the best in the class, but we'll see how it goes. Anyway, I'm already pulling up to Spawn Shoreline. It's very dark, so I hope that didn't ruin the whole video, but if it did, sorry about that. I will see you guys in a little bit. Hello! Anyway, I finished my clinical rotation thing with them at Spawn Shoreline. It was a lot of fun. It was pretty hectic at first because I had more students than what I'm used to, but we made it work. They all finished all their patient encounters, so I'm very happy about that. They were a nice group of students. One of them was really on top of everything. Their narrative writing was impressive, so I was really happy to see that. Some of them were better than mine, honestly, excuse me. But overall, I just had a really nice time. The nurses were really receptive to me sending in students. Afterwards, we finished early, so I just started reviewing with the national, or I started reviewing over the national with them. So they were very receptive to it. That's fine. They were very receptive to it, and they did a really good job. So overall, I'm happy. Next, what am I gonna do? I'm gonna go to the gym. I'm gonna go work out. I'm probably gonna do legs, maybe some cardio, and then I'm gonna take a nap. I don't know. But thank you guys so much for everyone who's watching. I sure had a blast. You know what? Also, real quick, I went over the APGAR scoring with them, with all 6 of them. And in my head, I'm like, this is so easy. It's common sense. It makes perfect sense. They all did horrible. I was trying to prove a point with them, and they all did so bad on it. And I was like, it's okay, guys. Like, don't worry about it. We'll figure it out together. But I was appalled by how bad they did. It's okay, though. Anyway, if you did like this video, please consider liking, commenting, subscribing. If you made it all the way to the end of the video, please comment Boss Baby for me looking like a baby with a bald head, right? So please leave a comment, Boss Baby. Consider joining the Discord. We'd love to have you there. Consider joining the channel membership. It's a lot of fun. We have a lot of fun. I offer almost nothing for the channel membership except for this. This should pop up. It's a crappy image of everybody's name. And I'll see you guys in the next one. See ya.